Today we will be completing the neurological assessment.
Morning.
Hi,
My name is Angie. I'm going to be your nurse today. I'm going to be doing an assessment on you. Can I see your name band? Can you tell me your name and date of birth?
my name is Charlotte. My date of birth is 7/7/75.
Okay. Prior to entering the room, I would have performed hand hygiene as well. In my discussions with Charlotte, I'm going to be assessing her basic level of consciousness and her mental status. If I had concerns or any questions about this, I would evaluate her on the Glasgow Coma Scale, which is an evaluation tool in relation to her eye-opening response, her verbal response, and her motor response. So the beginning of this skill, we're going to go ahead and start with testing the cranial nerves. So we're going to start with cranial nerve number 1, which is the olfactory nerve. So I'm going to have you go ahead and close your eyes and occlude one of your nares, and I'm going to hold a scent underneath her other nare. And can you tell me what that scent is?
Cinnamon.
Cinnamon. Yep. And then you would do the same on the other side with a different scent. The second cranial nerve is the optic nerve, and we will assess her near vision, her distance vision. So the distance vision is using the Snellen chart. So I'm going to have you stand up, and you have the patient stand 20 feet away from the chart. We're going to use our imaginations and pretend that we're 20 feet away, just directly out from it. Can you go ahead and cover one of your eyes and read the smallest number that you can?
LEFODPCT.
Okay, so that is line number 9, and that says that she's reading 20/15, which means she can see at 20 feet what the normal person can see at 15 feet. So cover your other eye and do the same thing.
DEFPOTEC.
Okay, and I see that she's reading line number 8, and that is 20/20, so she's seeing at 20 feet what most people can see at 20 feet. And then you would have them go ahead and just do the same thing again with both eyes. And then you would note that. And I also see that she is wearing corrective lenses, so then you would note that in your documentation. Okay, I'll have you have a seat. And we're going to go ahead and assess her near vision by using the Jaeger or the Rosenbaum test. So I'm going to go ahead and just use the Jaeger test, and I'm going to give this to my patient, hold it about an arm's length away, and go ahead and read the smallest line that you can.
In the 2nd century of the Christian era, the Empire of Roman comprehended the fairest part of the earth and the most civilized portion of
Okay,
mankind.
very good. So that is to be noted that she could read that. We are going to then assess cranial nerves number 3, 4, and 6. So these are the ocular motor, the trochlear, and the abducens. This is assessing the eye movement. So how is the patient, are they able to control their eye muscle movements? One of the tests that we're going to do this is the 6 cardinal fields of gaze. Okay, Charlotte, I'm going to have you keep your eyes focused on this flashlight, and I'm going to move it in the diagonal area, and then I'm going to horizontally across, and then lower diagonal, and then the same on the other side. I'm assessing if she has any ptosis or eye drooping or any asymmetrical movement with her eyes, if she has any nystagmus, twitching. Those are some things that I'm assessing with that. I'm also going to assess her peripheral vision, so facing your patient. I'm going to have your patient cover her right eye, and I'm going to cover my left eye. I'm going to hold an object out, and Charlotte, will you tell me when you see this in your peripheral vision? Don't look at it though, only look at me, and you tell me when you see it.
Okay. All right.
Okay, so that's assessing peripheral vision. And again, we're also going to check her pupils using Perla. So I'm going to assess to see if her pupils are equal, round, reactive to light and accommodation. And you normally would do this in a dimly lit room. Pupils they have different sizes. On your handy-dandy little flashlight here, it's a pupil gauge, so you can use this for documentation purposes. So I'm going to have you just go ahead and look straight ahead. Okay, and I see that her pupils constrict from a 3 to a 2. I'm going to assess the other one. And accommodation, if you're wondering what that means I'm going to have you focus on this flashlight and just follow it all the way in. And she's following it all the way in. Her eyes are symmetrical as it comes in towards her nose. All right, cranial nerve number 5 is trigeminal. And this is assessing the face sensation and the strength of her jaw and her mouth. So I'm going to have you, first of all, go ahead and clench your teeth, okay, and then open your jaw. Okay, good. And then I'm going to have you kind of just close your eyes. And I'm going to see, do you feel this on your face?
Yes.
Okay. And go ahead and open your eyes. Close your eyes. Open. Close. Okay, she's able to eye blink on command. The 7th cranial nerve is the facial. So again, I'm going to take this cotton ball, and I'm going to have you close your eyes. I'm going to touch various locations on your face, and you tell me where I'm touching you at.
Left cheek, forehead, chin.
Okay, very good. And I'm also going to have you smile. Okay, I'm noticing that her smile is symmetrical, it's equal, it's not drooped. If you have a patient who has had a recent stroke, you might notice that when they smile, one side of their mouth is drooped down. The next cranial nerve is the acoustic. We're going to talk about, we're going to use the Rene test, the Weber test, and the whisper and the finger rub. These are ways that you can test her hearing. So you're going to want to take your appliance here, tuning fork. You're going to take your tuning fork and you're going to activate it. And what I'm going to do is I'm going to test her air conduction and her bone conduction. So with the Rene test, I'm going to activate the tuning fork, and I need to have a clock in my vision. So when I activate the tuning fork, I'm going to place it right directly on her mastoid bone, which is behind her ear. And then I'm going to have her tell me when she doesn't hear it anymore. And when she doesn't hear it anymore, and I'm going to then move it in front of her ear. And then she's going to tell me when she stops hearing it. So what the normal response would be, that air conduction is twice as long as bone conduction. So say that she hears the mastoid, the bone conduction part for 5 seconds, and she hears the air conduction for 10 seconds. That would be considered a good result. Also, it depends on how hard you activate the tuning fork. So I'm going to go ahead and try it.
Okay.
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 Okay. So let's say she heard that on the bone about 5 seconds and the air about 10 seconds. One thing to note with these tuning forks, when you activate them, only hold on the neck of it. If you hold up here, you're going to deactivate it and your test won't work. Okay, so the Weber test is to assess if you hear sounds equally on both sides. So you're going to activate the tuning fork, and I'm going to place this on her top of her head, on her parietal bone, and she's going to tell me if she hears it equally on both sides.
Yes.
Okay, very good. The second test, the third test we're going to do is a whisper test. So you're going to stand behind your patient, and you're going to whisper a word to them and have them repeat it to you.
Circus. Ohio.
Okay, good. And then the last hearing test is we're going to test and see if you can hear fine sounds.
Okay.
So go ahead and close your eyes. Tell me if you can hear my fingers rubbing by your ear.
Yes. Yes.
Okay, very good. Next we're going to check cranial nerve number 9 and 10. This is the glossopharyngeal and the vagus nerve. So you don't have to actually test the taste on your patient. You would verbalize that you would give them bitter, sweet, salty, and sour items to taste and identify. You would also check their gag reflex, but you as well will just verbalize this. But you will have your patient swallow. Okay, she swallowed, her trach is midline. There doesn't seem to be any difficulties with that. And then you also want to assess your patient's hard and soft palate, and you can do this by having your patient open their mouth and say ah. Okay, very good. Cranial nerve number 11 are checking the spinal accessory nerves, which are the trapezius muscles and the sternocleidomastoid muscles. So the trapezius muscles are, those are the shoulder shrugging muscles. So I'm going to have I'm applying pressure to her shoulders, and now go ahead and shrug. Okay, and I'm assessing her strength, symmetry, equal. And then I'm going to go ahead and check her sternocleidomastoid muscles for strength, symmetry, equality. These are the muscles that turn your neck. So I'm gonna go ahead and put my hand on her sternocleidomastoid, and then I'm gonna have you push against my hand. Yep, very strong. Okay, very strong. The next one is hypoglossal, and so this is what we're checking your tongue. So again, if you had a patient who's had a stroke, go ahead and stick your tongue out. I'm checking to make sure her tongue is straight and not deviated to one side. If a person has had a stroke, their tongue might stick out to one side. All right, next we're going to move on to assess balance, coordination, symmetry, and strength of her lower extremities and upper extremities. So we're going to check the cerebral function for balance and coordination by doing 2 tests to check for balance. So I'm going to have you go ahead and stand up, and we're going to first just do the Romberg test. And that just is checking your balance. Don't do this if you don't have the patient. Make sure you have the patient by a bed or a chair, because they might actually get pretty tipsy. So go ahead and close your eyes and just stand still. And I'm assessing her balance, if she's swaying or if she seems to be losing her balance. Okay, very good. You can open your eyes now. Next, I'm going to have you do a heel to toe walk. Again, she's not swaying or tilting. Heel to toe. Okay, very good. So now I'm going to have you go ahead and while we're standing up, we're going to check her lower extremity coordination. So I'm going to have you go ahead and take your heel to the opposite shin and slide it down. Yep. Okay, and then you would of course have them do it on the other leg as well. Okay, very good. Now let's check the coordination on your upper extremities. So using your palms, having your palms down, I'm going to have you alternate palms up and down on the thighs. Yep. Can you go faster? Okay, very good. The second test to evaluate this is finger to thumb. So I'm checking her coordination. Can she do this? Yep. Okay, very good. Okay. Now we're going to go on to assessing sensory functions. So all of these tests are done with your patient's eyes will be closed. So we're going to go ahead and check sensation to light touch. So I'm going to have you close your eyes. I'm going to touch your skin on different places, and you tell me where I'm touching you.
Left arm. Right hand. Right arm.
Okay. The next thing we're going to do is assess sharp and dull sensation. So what I have here with me is a broken tongue blade. One side is sharp and the other side is dull. So with the patient's eyes closed, I'm going to touch you with a sharp or dull point, and you tell me if it's sharp or dull.
Sharp. Sharp. Dull.
Okay, very good. Next, we're going to check the patient's vibratory sense by using the tuning fork. So I'm going to put this tuning fork on a bony prominence, like your elbow, and you tell me if you feel it.
Yes.
Okay, very good. Next, we're going to assess the kinesthetic sensation, or the sense of proprioception. This is when your patient's eyes are closed, and I'm going to go ahead and take your hand, and I'm going to move your finger up or down, and you tell me if it's up or down.
Up. Down. Down. Up.
Okay, very good. The next test we have is called stereognosis, and that's placing an item in the patient's hand and having them identify it without looking at it. So here's your item. Can you tell me what that is?
It's a key.
It is a key. And here's your other item.
Feels like a penny.
It is a penny indeed. Okay, next test is graphesthesia, and I'm actually going to write a number in your hand, and then you tell me which number it is.
4.
Okay, very good. So the next 2 tests we're going to do have to do with, it's called 2-point discrimination and extinction. So I have a paper clip. It's an open paper clip, and I'm going to be touching your skin, and you're going to tell me if you feel 2 pokes or 1. Okay?
2. 2. 1.
Okay, very good. next test is to test for extinction, which is I'm going to have you tell me when you no longer feel 2, but 1.
Okay.
Okay? So go ahead and close your eyes.
2, 2, 1.
Okay, very good. And then we're going to test for point location. I'm going to have you keep your eyes closed. I'm going to touch you on your upper arm, lower leg, shoulder, face, and you tell me where I'm touching you at.
Knee. Elbow. Shoulder.
Okay, very good. And last but not least, we need to evaluate your reflexes. So starting with your triceps reflex. When you are eliciting your triceps response, you want to have your patient just dangle their arm, and then the tricep tendon is of course back here by the elbow, and then you're just going to strike this tendon with the hammer. Okay, very good. Next is the bicep reflex. So I'm going to have you roll your shirt up. I'm finding the tendon